Hello, my name is Shelby Rutledge, and I'm a speech-language pathologist and listening-spoken language specialist, certified auditory verbal therapist. In this module, we will discuss auditory brain development, hearing age, and speech acoustics as they relate to learning to listen. Children who are deaf or hard of hearing can learn to listen and speak through the use of early diagnosis, technology, aggressive audiological management, early and appropriate auditory-based intervention, and dedicated parents and professionals. Everything we know and understand about childhood deafness has changed. Why? Technology, cochlear implants, and principles of practice, auditory oral or auditory verbal, allow us to deliver meaningful auditory experience to our children, and also the studies of the brain and brain neuroplasticity. Neuroplasticity is the brain's ability to grow, develop, and alter its structure as a function. Think of the brain as a sponge and that it has the ability to soak up information and develop its neurons. Neuroplasticity is the greatest during the first 3.5 years of life. Therefore, early identification, amplification, and intervention are crucial. In the absence of sound, the brain reorganizes itself to receive input from the other senses, primarily vision. This is called cross-modal reorganization. Think of it as the visual neurons multiplying and overtaking the auditory neurons. Auditory brain centers must be stimulated early. The cochlea is formed and functioning by 20 weeks of gestation. Infants are born with 20 weeks of listening experience. It's all about the brain. We hear with the brain. The ears are just the way in. Hearing loss is not about the ears, it's about the brain. Hearing aids and cochlear implants are not about the ears, they are about the brain. Anytime the word hearing is used, think auditory brain development. The brain is developing auditory neurons and auditory pathways, which are critical in learning to listen. Hearing versus listening. What is the difference? Hearing is acoustic access to the brain. New hearing aid and FM technologies and cochlear implants have allowed access to critical auditory brain centers. Listening is attending to acoustic events with intentionality. Hearing must be made available before listening can be taught. Children learn to talk through listening. I'd like to now go over some important terms used in learning to listen. The first is hearing age. Hearing age begins when the child's hearing is accessed through appropriate technology, such as the hearing aids or cochlear implants. When a child's cochlear implant is turned on or activated, or when the child has been appropriately aided, that is day one of hearing. Hearing age also refers to the amount of listening experience, and it puts progress in perspective. Here are some examples of hearing ages. A child has a chronological age of 6 months, aided at 3 months of age, so his hearing age is 3 months. He's had 3 months of listening. Another child is 3 years old. He was implanted at age 2, so his hearing age would be 1 year. Another example is a 24-month-old. He was aided at 23 months, so his hearing age is 1 month. We also need to look at the child's other ages. These include his or her chronological age and his or her language age. A language age is the language level the child is functioning at. So a child can have many ages. For example, his chronological age could be 7 years, 2 months. He could have a hearing age of 5 years, 2 months. And he could have a language age of 3 years, 9 months. We will use these ages to measure progress. Our goal is to close the gap as much as possible between a child's speech and language age and his or her chronological age. Now let's talk about speech acoustics. Why is this important? Knowledge of speech acoustics provide a basic understanding of speech sounds, and their acoustic properties will help us as parents or professionals to determine what sounds the child is hearing with their hearing aids or cochlear implants when compared to their audiograms, and what strategies, techniques to be used in intervention. As you recall from the audiology module, the speech banana is a term used to describe the area where the phonemes or speech sounds appear on the audiogram. When these phonemes are plotted out on the audiogram, they take the shape of a banana. While many other sounds fall outside of the speech banana, audiologists and speech professionals are most concerned with the frequencies within the speech banana because a hearing loss in those frequencies can affect a child's ability to learn language. Segmentals are the vowels, diphthongs, and consonants. They're the actual speech sounds of language. Suprasegmentals refers to the prosody or the melody and rhythm that underlies our speech. Suprasegmental information helps the child discriminate, recognize, and comprehend language. Suprasegmental information includes duration, which is the length of sound, word, phrase, or sentence, intonation, which is pitch or stress variations, and pitch, which is the frequency of the sound, and this is measured in hertz. Suprasegmental information includes rate, which is the speed at which a series of sounds are produced. Rhythm includes duration, rate, and stress patterns. Suprasegmentals include stress, which is syllable emphasis, and intensity, which is the force with which the speaker produces a sound, and it's perceived as loudness. This is measured in decibels. Sounds differ from each other in frequency or pitch, intensity, and duration. Vowel sounds are the strongest in all three areas. They are lower in frequency, louder, and longer in duration. Vowels are the easiest for a child with hearing loss to both hear and produce. Consonants are generally higher in frequency, softer in intensity, and shorter in duration. Low-frequency speech information, the vowel sounds, contribute 90% of the energy to the speech signal. However, only contains 10% of the meaning. High-frequency speech information, or the consonants, contribute 10% of the energy to the speech signal, however, contains over 90% of the meaning. That's why it's very important that a child with hearing aids or cochlear implants hear those higher frequency speech sounds such as S, T, and D. These sounds are necessary for the meaning of language structures such as plurals, third-person singular verbs, and regular past tense verbs. Okay, let's review. Try to answer or fill in the blank. Neuroplasticity of the brain is the greatest during the first blank of life. The answer is 3.5 years. Infants are born with blank weeks of listening experience. The answer is 20 weeks of listening experience. Segmentals of speech consist of blank and blank. These are vowels and consonants. And the last one, and the most important, we hear with the brain. Thank you.